Alright, I'm walking into the patient's room. Good morning, my name's McKayla. I'm going to be your nurse today. How are you? Oh, I'm okay, hanging in there. Okay, good to hear. So, going to start off, please verify for me your name and date of birth. It's Caitlin Manick in 3/11/98. Okay, thank you, Caitlin. Caitlin, are you aware of why you're here right now? And do you know where you're at? Yeah, I'm in the hospital. I know that I got diagnosed with something and I have to have surgery done today. But, I'm a little fuzzy because this pain has, it's been a lot of pain and I'm kind of just, a little fuzzy in the brain right now. Okay, well, no worries, Caitlin. So you know where you are at right now, so that's wonderful. I would say patient is A&O times 4. Or I would probably say A&O times 3 since she's a little confused. But anyway, so Caitlin, you're here now. You're in the pre-surgical unit, and I'm here to get you ready for surgery that is happening in about an hour and a half. And I'm here to just get you settled, answer any questions you have, and make you feel as comfortable as you can. I'm going to get some vital signs and bits and pieces of a physical assessment, just making sure that we are doing okay. And so if I can answer any questions for me, please tell me. I see your mom is here today. Mom, please chime in at any time if you have any questions as well. Okay? So you're here for your surgery, and so you have been diagnosed with appendicitis, and what that essentially is that you've been feeling a lot of pain in your stomach area, right? Oh yeah, so much pain. Okay, so a blockage has happened in your appendix, and when that happens, it's usually a blockage. So in your case, it was a blockage from stool buildup, and it can also be from foreign materials, but when that happens, your appendix becomes inflamed, and then it results in a pus buildup, so bacteria buildup, and an infection. And so we have to treat that as soon as we can. And how we treat it, we have to do a surgery to remove the appendix. You're able to live a normal life without the appendix, so there's no worries there. However, it's great that we are being diagnosed it and are getting it treated as soon as possible, because if things do delay, then it could potentially lead to a rupture, which we won't go there, but that leads to a lot of complications. But it seems like we're doing okay right now with our timeline, so we're going to get you into surgery, get you fixed up, and you'll be on your way in no time, okay? I am going to go ahead and get vital signs here, so temperature, and then put your pulse ox on, and I'll read the heart rate. Okay, temp is 101, so it's gone down a little bit from the ER, and the pulse is good. I don't need to administer any oxygen right now, so I'm making sure that this stays above 92%, okay, and we are at 98, so we're doing good there. Heart rate has gone down a little bit to 95, and looks like your respirations are 17, equal expansion. Are you having any shortness of breath or chest pain? No? Okay. And then any coughing? Yeah, no coughing. Okay. Awesome. That's good to hear. And I'll take your blood pressure. Okay. Blood pressure at 130/80, so that's looking better from the ER. And so just a couple things. I'm going to go ahead and listen to your lungs. So deep breaths in and out. Okay, S1 and S2 is present. Okay. So your lungs sound nice and clear. S1 and S2 is present, so your heart is pumping, it's doing good. I'm just gonna check for any edema, cap refill. Okay, that looks good. Skin turgor, fluids are good. Check for any edema down here, cap refill. Okay, so I'm going to pull up here. I'm just gonna look at your stomach area. So you have been having a lot of pain, correct? So let's say from on a scale from 0 being the least pain you've ever had and 10 being the worst pain, what kind of pain are you experiencing right now? Oh, I'm feeling like, I don't know, maybe a 9 out of 10 right now, especially in that lower corner of my stomach. Okay, yeah, so it looks a little bit ascended, a little inflamed. We're definitely gonna get that fixed up for you, okay? Please let me know again. So pain is super important. You have to let us know how you're feeling, and just being honest with us, because we can get you some pain medications to help alleviate that for you, and implement any practices that could help alleviate some of that pain for you. But you have to be verbal with us and honest about that, okay? So I'm gonna go ahead and listen here. Okay. And I'm just going to touch lightly. Let me know if you feel any discomfort. So when was your last bowel movement? It was yesterday. It was more like diarrhea. Yeah, watery. Okay. And any nausea, vomiting? Oh yeah, I have felt really nauseous and vomit. Okay, how many times? I think I vomited about 2 times yesterday. 1 time this morning right before I came to the hospital. Okay. All right. So I'm gonna put this back here. Alrighty. So just gonna get some history here. Just ask a couple questions and then do a couple teachings. Okay. It looks like you did have a ACL surgery last year. Is that correct? Yeah. And how did that go? Oh, it actually went really well. As good as it could. Mom, yeah, it went fine. She recovered nicely. No complications during surgery. Okay. Well, that's good to hear. So, no complications with that surgery. Hopefully we won't have any complications with this one. And any bad reaction to the anesthesia? No? Okay. That's good to know. Because you will be going under general anesthesia for this operation. So it looks like that is good. Surgery history. So medical history, any things that you need to tell me are you pregnant? No. Expecting? No. Okay. When was your last menstrual cycle? Last week. Okay. And it was pretty normal? Yeah, it was my normal menstrual cycle. Didn't have any problems. Okay. That's good to know. Are you a smoker? No. Okay. And you have any alcohol or substance abuse issues? No. Okay. That is good to hear. That's going to help with healing. That you don't have any of those, underlying history problems there. I have your list of medications. It looks pretty minimal here. We're going to make sure that we aren't administering any medications that will, alter those medications or cause any bad reactions. I am going to be administering lorazepam, which will help with your anxiety. And with that being said, is there anything that you feel anxious about right now that you would like to talk about or clarify? It looks like you have a great mother here to support you after your surgery. She's going to be bringing you home, so that's good that we know that you have a good, safe, and reliable way home. But is there anything, that is kind of stressing you out a little bit? No, honestly, I just feel really good that I'm getting into surgery right now. And like I said, I did have ACL surgery last year, and going through that experience, I felt very anxious. But now, this one, obviously I feel a little bit of anxiety just because, surgery poses the things that they pose, but I'm feeling pretty okay about it. Okay, that is good to hear. Please let me know, those things. I'm here. I'm your advocate, so please let me know if you feel, any anxiousness or you have any questions that I could clarify for you that could help, kind of clear your mind, okay? All right. Thank you. Okay. So just a couple of teachings here. So we want to prevent deep vein thrombosis. So do you know what that is? Yeah, they told me about that when I had my ACL surgery and I got compression stockings. Okay, so yeah, so we just want to make sure that the blood from down here is returning back to the heart in an appropriate manner, and so we will probably be putting on some type of compression after surgery to help with that. We just don't want any blood clotting to occur. And so it's really important that you cough and deep breathe. So we might use an incentive spirometer after, or I might just teach you how to do those things depending on, how things go. Have you used an incentive spirometer before? You probably did with ACL. Yeah. Okay, cool. So you know how that goes. I'm just going to have you practice your deep breathing and coughing with me now so that I feel confident that you'll be able to perform these things after surgery, okay? So I'm going to give you a pillow here, and I want you to just hold on to that pillow, okay? It's going to be over your incision, and I'm going to have you breathe in through your nose, purse your lips out, so like your kissy face, and breathe out. Okay? So that's that deep breathing that I want you to be doing. So maybe do like sets of 3, and pretty. I want you to be doing that a lot. Okay, it's important that you do it after surgery. Okay, and then as far as the coughing goes, so how I want you to do that is you're gonna deep breathe through your nose, and then you're gonna let out a cough. Okay. So that's just going to make sure that any fluid buildup in your lungs are staying nice and loose. We're getting that out. We're maintaining a clear lung field, okay? So, okay? All right, let's see if we can do that. All right, wonderful. Thank you, Caitlin. All right, so like I said, that is super important after surgery. So that's things that we will teach you again, and also, do that in the hospital, but also at home too, okay? And also, so one more thing is mobility. We want to make sure that you're staying as mobile as you can. Obviously, after surgery, they're going to have some physical limitations, and obviously those things are normal, but we're going to try and get you back mobile and, back to your normal routine as soon as possible. So just, some raising of your arms, circling, moving your hands as much as you can. Obviously, if that's causing any pain or discomfort, then limit those things, okay? And then same with your feet here. You can do some flexing of your ankles, moving your leg up and down if that doesn't cause you any pain, okay? Alrighty. So, Caitlin, right before, so I'm going to get you to sign this consent of surgery. So this is just that I have told you what is going to go. So I'll restate it now. So we're removing your appendix because you have been diagnosed with appendicitis. So it's going to be, the surgery lasts usually like an hour, 2 hours, depending on the patient. but usually an hour, and recovery is normal. You're going to be going over going into general anesthesia, and so the complications should be limited, and this is just signature of consent that you're okay with the surgery. Okay. Alrighty, so a few things before I head out. The surgeon and the anesthesiologist will be coming in to visit you shortly. Please let them know if you have any questions, and they're just going to go over your anesthesia, and then as well as more details about the surgery. And before we get you down to the operating room, we're going to put you in a clean gown and clean you up in any ways you want. If you want to brush your teeth, use mouthwash. We're going to have you remove any jewelry. You don't have any nail polish, so that's good. And if you have any contacts, we'll get those removed. And then we're going to make sure that you go to the bathroom as well right before. Okay, so your surgery is about an hour. I'm going to make sure that lorazepam and the IV is administered. I can't do that, but I will get a helper. And so do you have any questions for me? I'm here for you. I'm your advocate. Please let me know if there's anything that I can do for you or your mom here to make you more comfortable with this whole process, okay? All right, thank you.